Welcome back, everyone, to the podcast Conversations and Connections. I'm your host, Sandy McGregor. And again, it is a delight to bring you faith stories and the goodness of God in the lives of the people that I get to interview. So I get to interview, once again, my friend, Sandra Tadros-Guirguis. And I'm so excited to have you back. And I knew we wanted to do this before. Because there was too much to talk about in our last conversation, which was so good. But I'm going to link it for sure so that people can go back to the first one to get a little bit more of an in-depth understanding of kind of who you are in your journey. Because today we're going to talk a little bit about that, but then we're going to dive into this really incredible topic today on menopause. So even if you're a guy listening today, maybe you should be listening to understand the woman in your life and what she is going through. And I know that you have taken a very specific course that I can't wait to talk about that's helped you understand more so that you can help people like me. Yes. So I'm very excited. So just briefly, Sandra, you are a public speaker, you're an author, you are a healthcare and fitness practitioner, and you're super passionate about the overall health and the wellness of people, and the different programs you've created have been absolutely life-changing for people. You are a licensed clinical pharmacist, and these treatment plans specifically are with people with chronic disease, and you've specialized them and they've become comprehensive so that you can walk them through whether it's a weight loss journey, a fitness journey, or a sleep issue. And now we're going into menopause. So, so that's just a little brief introduction. So maybe tell us a little bit more about you and what you do.
Sure. A little bit about me. I love cheesy jokes. I love Jesus. I love Sandy. I'm part of a blended and blessed family. Like to be active, out and moving, and for work. Yes, I work in a family health team, which is multidisciplinary healthcare setting, and I also teach fitness classes. So I work right across the wellness sphere, whether that's talking to young adults or older adults or the youth at a church, or speaking to a company for their wellness, teaching a group fitness class, or sitting with a patient in clinic. So that's sort of what my days look like. And then I'm in a particular season where I have teenagers now that are very, very busy with their sports and their extracurriculars. So I have what I like to call my teen Uber shift, right, in the evenings.
Yes.
So that's where you'll probably see me on the road somewhere.
Passing you by saying, hi, Uber.
Yeah.
The mommy Uber.
Yes.
Yeah. Yeah. Well, I really appreciated the book. And I wanted to make sure we talked a little bit about that because if you're listening today for the first time, you may not know that she is also an author, as along with a speaker and fitness and all of these amazing things. So the book called Embracing Abundance, A Journey to Wellness and Wholeness Through Faith and Self-Care. And again, on the podcast before, we talked a lot more about your book. But maybe talk a little bit about this to introduce somebody today who's hearing about it for the first time. And how did this book come to be? And why was this book so important for you to put out there for people to encourage them?
Sure. So when I was third, it started before that. So my late husband was sick and he got better and he was sicker and he had cancer. And my faith during that time, we prayed, believed in miracles. And then when he finally passed, my kids were 2 and 4, and it was a really difficult time for many reasons. Not
Oh,
only,
so difficult.
sometimes one person is so many things to you, right? Like that was my spouse, my best friend, my partner, the father of my children, but also it hurt, it cut deeply because I felt like, well, God, you are the God of miracles.
Yes.
You could have easily stop this tragedy. Why didn't you?
Yeah.
So it was a very, very painful time because I just felt disoriented in every way, identifying to being a widow, a single mom, upset with God, who'd been my best friend forever. And from that, it was really a difficult and dark season. And eventually, it wasn't because of any kind of self-strength or any of these things. It was truly from hitting rock bottom and discovering that I really did need God. So I started to kind of inch towards him in that fractured childlike way. I was like, I'm still mad at you,
Yes, I
but
understand.
can you help me?
Yes.
I'm
Yeah.
really hurt,
Yeah.
but I can't do this alone.
Yeah. Yeah.
And so in that time, was when I really, I think, leaned on him the most. And I
Mm.
discovered worship music, which I didn't know existed till then, believe it or not. I knew church hymns and mass,
Yeah.
and we are Coptic Orthodox. So there's very traditional and beautiful hymns, but I had
Good.
never heard like, gritty, like rock
Yeah.
worship music that I could feel angsty
Yeah.
to while I was
Yeah.
running on the treadmill,
Yeah.
right?
Yeah.
So all of that played a role: music, faith, prayer, people who prayed
Mm.
for me and with me when
Mhm.
I was too angry or
Mhm.
too disoriented to find the words. And
Right.
and really, as a 33-year-old widow, I had a hard time finding someone who is widowed young also. I had tried to go to groups, and I of course empathized with these women, but we were in completely different life stages. It
Right.
was hard to relate to, like, but my kids are young. What do I do
Right.
there? So
Of
I
course.
eventually had come across reading something or hearing about someone who was widowed young. And it wasn't even that I learned anything
Right.
worthwhile, but it was the idea of you're not alone. I went through this and you can too.
Wow.
And that's when I started getting encouraged and piecing together all of my clinical and wellness training, like
Mhm. Mhm.
10-minute walks. Let's
Right.
work on my gut health. That's what, creates my serotonin and dopamine, my happy brain chemicals. I'm going to buy kefir,
Yeah.
these little things. So put it all together. And it wasn't till like a decade later when I had really passed through a lot of that healing journey
Mhm.
and
Mhm.
eventually remarried my husband, Fedi, who's been so supportive and such a
Mhm.
rock about me
Mhm.
sharing my testimony, kind of said, why don't you put it in a book? And I was like, uh-uh.
You're like,
I like to
"Nah,
talk.
no."
No way. And and you know how sometimes, Sandy, you hear something and you can't unhear it, right?
Once it's
So
there, you're like, "Oh, the seed is planted. Now what?"
right.
Yes.
And it kind of buzzed around in the back of my head. And I was like, no, no, I wouldn't even, how would I write it? I wouldn't even know how to start. I don't have time.
Right.
And then one day I remember I was at a swim meet with my kids, and then they had these breaks, these long breaks, and they'd be sitting with their friends, and I wasn't
Mm.
needed. And I remember opening my phone thinking, well, just for fun, if I was to write things down, I wasn't even thinking a book. If I was
Yeah.
to write things down that I wanted to tell someone that was going through a
Right.
season of loss, even if it was the loss of a relationship,
Right.
health,
Yeah.
career,
Mhm.
grief is grief and it doesn't have to be bereavement.
Yeah.
What would they need to know? It's like,
Right.
well, the grief cycle, well, self-care, diaphragmatic breathing really activates the nervous system, these little things. And, it's a whole long story, but eventually that's how it eventually morphed into this book that really is my testimony, but
Mm.
it's written and the audiobook's actually in my own voice
That's so
is how
great.
I would write or speak to a
Yes.
friend that was struggling. Like,
Yeah.
I certainly don't have the answers, but look how good God is.
Yes.
And here's what Mayo Clinic says about self-care. And here's some
Mhm.
little tips for
Mm.
you to take into your toolkit. And I pray that God supports you. And this could just be
Yeah.
one of your many tools.
I love it. I love your courage and your bravery to actually put your story on paper because, as you know, you had your community surrounding you and they were walking with you, and you were able to get back up on your feet. And then you wrote this book, and now you are walking with people and helping them get back on their feet. And you may never even meet them on this side of heaven. And I believe that words are so powerful and so important. And it may be the book that changes somebody's trajectory on their wellness journey or their weight loss journey or whatever it might be that's hindering them, the grief process. So thank you for doing this. And I highly encourage you to get the book. It is a fantastic book. It's super practical and really, really an encouragement. So thank you for doing it. And I know it was
Thank
hard.
you for sharing. It wasn't as hard as I thought, only because I didn't feel any of that pressure on myself. A friend
Mhm.
reminded me of this verse that says, I planted, Apollos watered, but it's God who gave the increase, right? So I always thought,
Mhm.
like, whether this goes somewhere or nowhere, God, like I was obedient to
Yeah.
you. And if anything worthwhile comes, it's because of you.
Yeah,
So,
absolutely. And I totally agree with that and second that because it is that obedience and the faith step. And it's like even starting your wellness clinic, the STG Wellness. I mean, that was a faith step in itself. And who would have thought, like 10 or 15 years ago, here you are today, and you're doing all these things that you were meant to do and blessing other people. And so, speaking of other people, let's go on to the women's side of things for just a minute.
yes.
So, in your clinic, so if I was to walk in there, What would I expect at your clinic if I was experiencing some menopausal symptoms? And what would you do for somebody like me in their early 50s? I mean, we know that menopause starts at a different time. It starts a little bit earlier. So maybe if we can go back and talk a little bit about what is menopause and what would somebody expect? And then we can talk a little bit about the course that you took and what inspired you
Sure.
to do that.
Sure. So the great news is, decades ago, people weren't talking about it at all. So the
Mm,
great news is now we're talking about it,
yeah,
but I feel like we have to be really cautious because we're almost now in an era of too much information and a lot of it's misinformation. So we have a lot of people with conflicting
absolutely.
things, right? They'll
Yeah.
say, well, I thought it was a doctor on TikTok that said this or said that. And so
Yeah.
a lot of kind of fact checking. So the very first thing most clinicians will do is sit and just go over definitions. So
Right.
we're all using the same sort of language. So
Makes sense.
perimenopause is that time around menopause, but it can be years before the final menstrual period.
Mhm.
And it can be a variety of symptoms. About 80% of women will have hot flashes or night sweats.
Mhm.
And we always tell them to be mindful of that and to also assess how severe it is.
Mhm.
Mild being, oh, I get a little hot, but it's
Yeah.
okay. Moderate being, I'm sweaty, but I can continue what I was doing. And severe being, I've got to stop and take a breath.
Yeah.
Or I woke up
Yeah.
and I flipped the sheets and I have to shower and that type of thing. It
Yeah.
can be a whole list of things. We've got a list of at least 50 items where it can be sleeplessness and
Yeah.
weight gain and joint pain and
Mhm.
a whole myriad of symptoms. So that's kind of perimenopause. Menopause is technically one day and it is 12 months since the last period. So once a woman has had an entire year with no periods, because we know during perimenopause, I didn't have it for three
Yeah.
months and then I had two in one month and it was
All over
super
the place.
heavy.
Yeah.
Yes. Then, okay, we have now reached menopause and the period after that is postmenopause.
Right.
So that just helps us know timeline.
Mhm.
Average age of menopause is approximately 51, with women up to the age of 55 and maybe
Mhm.
down to sort of 45, 46.
Mhm.
The women that we really ask to speak up and make sure they're seen are the women who go through early menopause.
Mhm.
So
Mhm.
a woman that has her final period and she's under the age of 45
Okay.
can be at higher risks of some of the complications of having too low estrogen. So we say you definitely come and speak to someone. You
Right.
may need hormone therapy
Right.
and different things like that.
Yeah.
For other women, I think what's important to know and sort of a missing piece
Mhm.
is, do women need to replace their hormones or
Yes.
not?
Yes.
And the Menopause Society did a great job, actually, and a lot of the head organizations changing the wording. You may have noticed you'll hear a lot of health professionals now calling it menopausal hormonal therapy instead of hormone replacement therapy or
Interesting.
HRT.
Okay.
And the
Yeah.
reason for that shift, people will start to notice, is the statement said the wording's actually confusing, right? The
Mhm.
word replacement makes you think like, have I lost something and
Yeah.
it needs to be
It's pretty
found or
severe.
filled?
Like it's quite, it's right on point of like replace, change or something. It's big.
Correct.
Yeah.
And so they're trying to say, well, how do we sort of change that wording to kind of educate? There's nothing to replace. Your
Right.
hormones are meant to be higher during the reproductive years
Mhm.
and they're meant to drop. And as long as it's not too early, you
Right.
continue living your healthy, robust life. But if women are struggling with symptoms and they're uncomfortable,
Right.
especially with hot flashes, night sweats, or bone loss, this is
Mhm.
where there's the most evidence about hormone therapy possibly being helpful, especially that sweet
Right.
spot, women that are under 60 years old
Mhm.
or within 10 years since their last menstrual period.
Good to
This
know.
was the cohort of women that seemed to
Right.
have done the best. And another thing that's important for
Mhm.
women to note is the only real big trials we have was the Women's Health Initiative in early 2000, but they were using oral estrogen,
Okay.
which is still available, but we are mostly going through now something called transdermal or through the skin. So that's a
Okay.
cream or a patch that can be applied. So
Okay.
there's a lot less of those side effects of less libido,
Okay.
increased, inflammatory markers and things like that. when we're getting estrogen that way. So it's so
Okay.
multifaceted.
Yeah.
And I guess the best advice or two things that I advise women is number one, speak up.
Mm.
Speak up about everything. I personally ask women the MQ6. It's 6 questions in menopause that kind of ask about
Mm.
how are your periods? Are you having hot flashes?
Right.
Are you having vaginal dryness? Are you having sexual concerns? Are
Right.
you having loss of urine? All right. So a lot of women don't realize that's
Mm.
connected, where all of a sudden, oops, I got to run to the bathroom, or I sneezed or laughed and I need to go, as well as sleep and mood, right? So we
Mm.
found, especially with the vaginal dryness, the research showed that something like over 75%, Sandy, of women were having some sort of concern, but
Mm.
only about 25% of women were speaking up about it. So that's a
Yeah.
huge,
Yeah.
huge care gap, right?
Honestly, I feel like that what you just said about the care gap is absolutely what I feel like I'm hearing in my circles. They kind of don't really go and talk about it, and then some do, and then some are like the patch or the cream. I don't really know. What do I do? And then you get too busy, and you figure I'm just going to manage these symptoms. I'll be fine, whatever, and it's okay. And I totally admit I've been like that, where you just kind of figure you just manage it, and it's really not going to go away. How is that really going to help me? So this is why this conversation is very encouraging to have women actually take that leap of faith and get out there, talk to your doctor, or go to your wellness clinic and lay it out there and say, what are my options? And help me walk through this so that I can live abundantly and fully,
Yes.
right?
And you nailed it about what's going to go away and what's not. So, as a first step, I guess, in all care, whether it's menopause or anything else, we always talk about lifestyle. And we
Mhm.
always, as a first line, want to make sure that we're maximizing our lifestyle
Mhm.
choices. So,
Mhm.
we know
Mhm.
that women are losing muscle mass at a faster rate during menopause, and
Mhm.
that can cause that redistribution and more fat gain,
Right.
especially around the waist. And
Mm.
why we don't like that is that's linked to increased cardiovascular disease. And a
Mm.
lot of women don't know what's the number one killer in women?
The
Cardiovascular
heart.
disease,
Yeah.
right?
And you don't think
So
about that, but it's, yeah.
no. So is our cholesterol good? Are we getting 25 grams of fiber? Are we
Mm.
getting good sleep, which helps us build muscle? So all of these things, are we eating good prebiotic and probiotic foods for nice gut health? So
Mm.
all of the lifestyle things are huge. Are we getting enough dietary calcium
Mm.
to prevent osteoporosis? And if people aren't sure, well, I don't know how much I'm getting, they
Mhm.
can actually type calcium calculator, those two words in their search browser. It'll take you to Osteoporosis Canada. You click
Mm.
the foods you have, and it does the math for you.
Wow, that's great.
Talks about vitamin D. So, are we doing all these things? And then, secondly, do we need more? Are there symptoms that are bothersome? And you nailed it. So, in terms of like things like brain fog and processing speed and hot flashes, most of that resolves. And it's just a matter of if you're not overly bothered, there's women that'll say, like, I'm good, it will pass. But the vaginal and bladder stuff are the two things that often don't improve on their own if they're
Mm.
problematic. So
Okay.
sometimes we'll say start with regular vaginal moisturizer, kind of like how you have a face
Yeah.
cream.
Right.
Replenish the tissues. If for intimacy, make sure you add a lubricant. A
Yeah.
lot of women aren't aware that silicone lubricants can actually increase yeast infections. So I always recommend use a water-based lubricant
Mm.
and that exercise that boosts
Right.
testosterone, blood flow, things like that. But
Yeah.
if you're still having,
Yeah.
I mean, there's women that will share like they have tearing and they have pain, and
Wow. Yeah.
please talk to someone,
Yeah.
or they're not going
Yeah.
places because of their bladder. So
Mhm.
this is where we really especially say like you don't have to suffer like that.
Right.
Um, and it won't just disappear, unfortunately.
Right. But I love that you don't have to suffer because, you need to talk about this with your friends. And I've actually been going through this text trail just recently with one of my friends was saying, okay, what is going on here? Does anybody have any advice? And so one of the girls on the podcast, she's actually a nurse. And so she has some really good tips and information. Then I was saying to them, well, you're not going to believe this. I'm actually going to be having a conversation with Sandra about all about this
Amazing.
stuff. So they're very excited to hear some of the tips and tricks that you have and different ways that we can approach this. So this is very practical. So I'm very
I'm so
excited.
glad. And
Yeah.
another one that I didn't mention, but it really bears mentioning, I think, especially to women of faith. And I know you'll agree with me when I share why. So,
Mm.
mood is another one. So,
Mm.
there's this new concept coming up of it's called windows of vulnerability. So, they found that certain women are just more sensitive
Mm-hmm.
to hormonal fluctuations and at higher risk for depression. So these are the same. Often my patients will say, you know what, Sandra, I feel weepy and I'm, super anxious. And this happened after my baby, postpartum, right? Or
Mm-hmm.
this happened in my teen years or wherever. So certainly
Right.
are at higher risk. And the reason I say especially women of faith is I sometimes will hear almost like guilt or shame, right? Well, women will say to me, but the Bible says, don't be afraid. So am I not being a good steward? And,
Right.
as a clinician, I always say, like, no, Jesus loves you. He made you. He knows everything. He means,
Mm-hmm.
like,
For
I've
sure.
got you. But like anything else, there is counseling and there's medication, and we're meant to really be good stewards of our body. And it in no way means that your faith is lacking
Right.
or you're a bad Christian or
Yeah.
anything like that. So
Yeah.
so please don't feel that for a second. If you're feeling incredibly anxious, if you are feeling continuous low mood, there is no harm to bring it up to your primary care provider, whoever you see, a family doctor, a naturopath, nurse practitioner. They can do a simple questionnaire for you, PHQ-9 or GAD, and at least get the conversation going. Is this something that's affecting your quality of life?
Yeah.
There's research for counseling and so many things. So I guess the real big message is we really want to break down any kind of stigma or
Mhm.
barrier around care, period.
Yeah, absolutely. And I love you that you're saying that because, and it can be overwhelming. You can think, oh my goodness, there's so many steps here. I don't even know where to begin. And that's why you're doing what you do so that you can have these conversations and break it down step by step. It's not going to be a quick fix. And it's something that we have to be consistent with. And then we take your advice and then we do what you're suggesting. And some things are going to work and some things are not going to work, right? But I think we have to go into it
100%.
with a mindset that, okay, I'm going to make that first step. I'm going to make the phone call. I'm going to make the appointment. And that's a big thing right there. And
Yes.
just start and, be careful about your Googling and all of the research,
Yes.
as you reminded us very wisely. Um,
If people want to go, we can share Sandy some good material that's
mm,
legitimate. So
yeah.
specifically about menopause. So the course I was telling you that I
Yeah. So
did,
we'll get into that course too.
it's the Menopause Society certified practitioner. So the Menopause Society is
Okay.
menopause.org. Used to be known as NAMS, North American Menopause Society. They changed their name. And
Okay.
this really is the biggest certification body for menopause.
Okay.
I'll show you this was our text, like one of the textbooks, that I had studied.
Wow.
And what I love
Oh
is
my
it wasn't
goodness.
just about hot flashes.
Yeah.
It was like, cancer screening and bladder issue and bone health, and you
Mm,
really had to show competency in the
yeah.
licensing and certification exam.
Right.
And they have all kinds of resources. Like this one is for patients, the
Okay.
Menopause Handbook
Okay. Oh, good.
that
That's
people can
fantastic.
order online, and it just goes through everything like
Wow.
frequently asked questions
Yep.
and things about sleep and practical tips. It's
Mm-hmm.
so good, and they
So
have things
good.
on the website. So I think right now, if you're thinking, well, I don't want to Google, but I really like to learn, and
Right.
I'm all about educate and
Yeah.
empower. So
Yeah.
I encourage everyone, go to menopause.org or
Mhm.
look up the Canadian Menopause Society. There's patient links, patient
Super.
handouts, and furthermore, you can find a list of providers that have this certification.
That's
There's
awesome.
not there's not a whole lot in Ontario, but
Right.
you will find some, and I would say that's who knows menopause like.
Right.
That's why
That's amazing.
I will go to for my own care, and
Yeah.
I say that truly having done the rigorous training through it, but you will find providers of every
Mm,
designation. So if
okay.
you're like, I'm looking for a nurse that does it, I'm looking for someone in my city that's a
Mhm.
naturopath or that's a family doctor, you
Amazing.
will find them. And these are people who live and breathe
Yeah.
menopause
That is
care.
so helpful. So talk about what inspired you to take the course because you have so much education behind you already. But what was that final kind of like, okay, yeah, click, I'm going to sign up.
Sure. So in school, in pharmacy school, in medical school, and nursing school, I'm sure we all learned about it, right? But
Mhm.
I think there's been such an emergence of new data in the last couple of years and position statements on management. And I remember specifically, so I think I told you I work at the gym and I have some women that have done my classes forever. And it was like a trend. It was like everywhere I turned, a woman would come up to me and go, Sandra, I've done nothing differently, but look at this, right? Gesturing to their kind of waist. And I
Yeah.
remember in the beginning being completely baffled, being like, I'm not sure why there's that
Yeah.
specific abdominal weight gain. And I remember
Right.
researching it specifically and finding in menopause, there's this redistribution of fat around the midline. Huh.
Oh, lovely.
And then I remember looking a bit deeper about, all the women that were all of a sudden complaining about depression. I was like, that can't be a coincidence.
Yeah. You're like,
And we're
this is
looking a little
interesting.
deeper and seeing that increased risk of susceptibility and
Mm.
so forth. And it was when I really started to realize that, yes, I can understand what's the word, kind of abstractly how menopause works, the ovaries stop doing this and that. But there's a lot of real life annoying things that are
Yes.
happening to women
I
that
would
I'm now
agree.
finding, yeah, are absolutely clinical and it's studied in the literature. And I genuinely wanted to learn more. I was always passionate about
Right.
women's health and always love when we have that connection and they
Mm.
open up and they share. And I wanted to be able to say, you're right. 62% of women are experiencing this. And
Right.
here's what the guidelines are for what can help you. And people walking away like, wow, I got some
Like,
non-drug options, some diet
good.
options, some exercise. Yeah.
Oh, I love that. What about, was there something particular in the course that really stood out to you that actually benefited not only somebody you know, but you personally? Like, what would be something that was almost like a revelation to you that you just thought, wow, you know what? I'm so glad I took this course. I mean, I know you're glad you took the course, but
For
is there
sure.
something maybe specific that stood out to
Yeah.
you?
There's a couple of things. Believe it or not, one is not directly related to menopause, but it was in the menopause
Hmm.
course, and it was just because we
Okay.
were looking at women and women's health. But it was actually about domestic abuse and the high rate in general
Hmm.
of women is one of the
Interesting.
things to be on your radar. And I
Yeah.
remember when I had a particular patient, and I don't know if it hadn't been on my radar, if I
Mhm.
would have noticed that there was
Interesting.
some bruising and she was covering her shirt. And I remember thinking, like, oh gosh.
Yeah.
And I just kind of asked, and even one of the questions that we kind of reviewed was really ask directly if you have a concern. And,
Mhm.
and she was like, so anyway, she shared that this had been happening and we were able
Mhm.
to connect her with our mental health team. So that was
Wow.
important because we're always
Very
trying to look at
important.
the whole
Yes.
person.
Yeah.
And another one that I think
Yeah.
is not so well known, every time I share it at a seminar or talk, a lot of women don't know the link between having like severe hot flashes and night sweats and cardiovascular risk. So
Mhm.
women who are having hot flashes, and remember, there's a lot of women that get them, but some mild, moderate. Women
Right.
that have them for a long time or have them pretty severely, there is a link with cardiovascular disease. Now, we're not saying that to alarm women or to
Right.
say, if you had bad hot flashes, this is going to happen. No, but it
Right.
really helps us put this on the radar of women. And they're like,
Mhm.
you know what? My cholesterol was a little high, but I didn't really make any
Yeah.
changes to my diet at the
Right.
last blood work, or
Right.
my blood pressure has been borderline and I didn't go to that follow up, right? So
Right.
now we really want to do what we call the ABCs. A is A1C or blood sugar,
Mhm.
B is blood pressure, C is cholesterol. So
Okay.
I've been really pushing women to stay on top
Good.
of it. And last but not least, on that same vein, we know that this is in women, but what a lot of people also don't realize is that women don't have classic heart attack symptoms like men.
Interesting. Okay.
So we call men, they call it the Hollywood heart attack, right? So the elephant, the pressure on the chest,
Okay.
and so forth. It's a little bit more classic, usually a little bit more to recognize, easier to recognize.
Right.
And it can be very non-specific, like my back, heartburn,
Mm.
my arms. So we always tell women, let's really be curious. So the same way we have curious and wonder about our faith,
Yeah.
um, in life, but also
Mhm.
about your body. If something
Right.
feels off, don't just assume that it's always heartburn, right? Could it be
It could be something
something
else,
else?
maybe.
Yes.
Yeah.
Ask, explore, check it out.
Oh, that's really good. That's excellent advice. I too was experiencing some things I just had questions about. And then you kind of think to yourself, oh, you know what? I don't want to go. It's a big deal. what if
Yeah.
they're just going to say everything's fine? And I thought, you know what? No, I'm actually going to go. And everything was fine. But I knew I needed to go to just figure out what was happening. And so I felt very relieved and at peace that I thought, okay, I went and I did it. And yeah, it was a
Yes.
time commitment because it's one appointment and then you go to another appointment and then you go to another one. And
Yeah.
but you know what? It's part of caring for yourself, right? And so it's like even when the physical comes up every year, like I've always been very much like very, very persistent about being consistent, so that I'm not missing something. And you know, I can always do more. And I'm sure women are listening today thinking, "Wow, I should probably book that physical."
Yes,
Yeah.
and just slotting in that self-care.
Mm,
I see a lot of women that are very, very sacrificial, right? Running around and they serve here and they do that in their family.
yeah.
But we have to remember that you just cannot, one of my good friends always says, you can't pour from an empty cup.
No,
So if we're meant
absolutely.
to go,
Right.
self-care is not selfish, it really is essential. And for women to pay attention,
Absolutely.
like, is
Yeah.
your hair falling out? Are you getting headaches? Are you having trouble sleeping? This is your body and your
Yeah.
stress signal, the amygdala saying, slow down,
Yeah.
back up.
Yeah. Yeah.
We
Yeah,
need some
it's
care.
warnings. Yeah, and it's good to talk about the symptoms that you might be having, even if it's with your husband, your spouse, or a friend, just to start talking
Yes,
about it. And then once you actually get it out and you start talking, that makes it's out there. And then you're
absolutely.
almost
Feel
like,
accountable. You don't feel
yes,
alone.
I'm just going to say that the accountability can be really hard for us in this day and age. But well, this is amazing information. And I definitely will link the site and your book and your site, so that women can dive deeper into it. So, what would you say to a woman who maybe is listening today and she's just at that stage of, oh, I heard this again, maybe I need to go? If she was to, you know, be in touch with your clinic, which would be a great step, what would you say to her today to encourage her?
You're not alone, number one. And number two, especially like menopause that we were talking about today, with people living longer and longer and projected life expectancy,
Mm,
women are going to be spending approximately half of their life in postmenopause. We want to make it great.
mhm,
We want to thrive with strong bones and strong muscles.
mhm.
It doesn't have to be overwhelming. You can
Right.
take small baby steps. Maybe you work on your fiber. Maybe you work
Yeah.
on booking that appointment with a clinician or care
Mhm,
team to
mhm.
just keep you checked and so forth. But let's do it.
Yeah, let's do it. I love that concept of care team because you
Yeah.
need a team and you do need that specialist. And we need somebody like you or at your clinic. You have, so you hear that somebody might need to go into counseling and you've got that right there at your clinic. So it's like this, that's where I love the whole concept of the holistic approach, because they don't feel like maybe they have to go to 5 different clinics all within like a week or two. And that's actually such a beautiful offering that you have. So I think it's
Yes.
great.
The
Mhm.
family health teams are excellent. I
Mm,
know them for sure in Ontario. I don't know if that model is elsewhere, but
yeah.
for your listeners that are in Ontario, the family health teams
Mhm.
often will have like registered dietitians, social workers, nurse practitioners,
Yeah.
family doctors, and pharmacy
Amazing.
support, which is nice because we all
Mhm.
collaborate and we all working right in your
Yeah.
chart and seeing you and seeing each other face to face. So nothing's lost in translation and
So
sending
good.
out a consult
Mhm.
note somewhere that may or may not
So
be received.
encouraging. Okay, last question because this was on our text trail. Um, the patch or the cream, is it something you choose or is it based on your symptoms? Or what would you say?
So, sure. So, you're talking about for a woman that wants to
Yes.
start hormone
Yes.
therapy. Okay.
Yeah.
So, the first thing we check, does she have any contraindications? So, we're assuming we've ruled that out. It's safe for her. Does she have a uterus? Is the next important question. So, if a woman has a uterus,
Mhm.
we cannot ever just take estrogen. We have to add progesterone.
Okay.
Otherwise, estrogen alone causes the uterus cells to proliferate. That can
Mm.
increase cancer.
Okay.
Progesterone turns those cells to secretory so that we're keeping everything safe. So that's important to note
Very important.
because of the dosage forms.
Yeah.
So when we say now, patch or cream is still how you're getting estrogen.
Mhm.
It is mostly patient preference of which
Okay.
we call it route of administration we're going. Same thing with the progesterone. So, for example, a woman that says, you know what, I don't like the mess or I don't want to take pills or
Right.
whatever it is, there's a patch that's estrogen and progesterone, for example.
Perfect.
Or there's a woman that's not sleeping well, for example, but wants a patch. I'd say, well, why don't you get the estrogen in the patch? And why don't we take the progesterone in oral form at night? Because the metabolite causes drowsiness. So we are just capitalizing on
Yes.
how the meds are absorbed.
Amazing.
However, the patches are a couple of days a week. So you
Okay.
have to be someone who can say it's Monday and it's Thursday.
You have to
Okay. And
remember.
that's a bit harder than every day. So someone will say, oh gosh,
Yeah.
I would forget what day it is. And we say, no problem, right? There is a cream you apply to the inner arms, and that's every day, daily, right? So there
Yeah.
isn't necessarily one that I would tell women you can
Mm.
or can't. I would say for anything, this is first line. It comes in a few different dosage forms.
Okay.
Let's get to know you and
Yes.
see what you're most likely to be compliant with to take regularly and to take appropriately.
Amazing. Oh, I love it. Thank you so much for all your information. Great answers. I'm so excited to be able to share this with women. This has been so helpful, Sandra.
Thank God.
I might have to line up and book an appointment.
Anytime.
I'll bring some of my friends with me. But yeah, well, thank you so much for being on the podcast and giving us so much wonderful information, and bless you in your journey with your speaking. If you need somebody to speak about these topics, she's available to speak. And as you know, her book, Embracing Abundance, is available now. You can order it on Amazon and wherever books are sold. So thank you, Sandra, for being with us today and giving us some more information that we so desperately need.
Oh, Sandy, you were so lovely. Thank you for praying over us before we started our
Oh,
conversation. Thank you for your kindness and thank you for your real heart of service. Just spending all this time and effort really to help people feel edified, strengthened. Really
oh, I
appreciate
love
you.
to do it. It's really an honor to be able to do it and have conversations with people. So, thank you again for your time, and I look forward to seeing you hopefully very soon.
I can't wait. See you.
Okay, talk to you soon.